Hey y'all. So this is the second part of our deep dive on leucovorin. So this is going to be more of a focus on the clinical trial side, um, the actual studies on efficacy of leucovorin as a treatment for anything, and then eventually we're going to get into the possible use in some way related to autism, and whether or not there is any basis for that. We'll see. So, our next step. Let's see. We've looked into this paper. We don't need this paper anymore. Just do a little cleanup. Um, these are our off-label uh, papers that we're going to look at in a little bit. Um, we have right. This is the adverse effects essentially, and that's both of these. And then we have back to our CFD topic. So, one thing that we can do to look into the like clinical trials, the treatment kind of thing, is we can read through the rest of this paper, which we will at some point, um, because there is a treatment section, which hopefully that means that this paper is going to refer to some of our useful other sources, like clinical trials or um, basic studies, things like that. We can also go to, and I'm going to open this on a different window just to make sure I'm nothing weird comes up. Yeah. Okay. I didn't know if my autofill was going to do something weird there. I don't know. You can never trust autofills. Okay, so this is clinicaltrials.gov. So this is just like this is the NIH's database of clinical trials, and we're looking at leucovorin. Um, so this is we're just looking for all studies. Wow, there are over 2,000 studies that have referred to leucovorin. Huh. That's surprising. Are they just referring to leucovorin? That. All right, we're gonna look specifically at leucovorin calcium. Huh. Calcium folinate. Okay, this is a little bit more specific, but wow. Okay, this does look more specific results than leucovorin did. And here you can see that it already it picks up other names of it. So calcium folinate is also leucovorin calcium. Um, wow, still 677 studies in the database. Um, and now this is interesting. Is there are studies recruiting for treatment of autism spectrum disorders with leucovorin. These are recruiting. So we want to filter by completed, because we don't want studies that are actively recruiting because there's no results, there's no data. So we want completed. Apply that filter. All right, so this is. Oh, this is another name that we can add to our list of alternate names. Is levofolinate. It's strange. I don't know why they would uh, add that to it. So levofolinate is another alternate name for uh, leucovorin. Oh, wait a minute. No. Sorry. Levofolinate is the mirror image version of folinate, which that gets into uh some chemistry stuff of. Yeah, that's the organic chemistry stuff. I don't really want to go into it too much because it's a whole separate side topic. But suffice it to say, levofolinate is not exactly folinate. Not exactly. So we have folate absorption in the large intestine. Whatever. Um, pyrimethamine, which that's the antibiotic. Wonder if there's a way to look for it only in the actual. Oh well, this is a good filter. Is studies that are completed and have results because we're interested in actual results of studies. Oh wow. Okay, so there is actually a clinical trial result in autism. When was this? Let's see. It was the University of California, San Francisco. It was in 2019. Sorry, this is potentially a very, very relevant study to look at. Okay, I'm trying to keep on track. That is going to be an incredibly important thing to read later once we get to the spicy topics section. Um, because that's going to get directly to this this the usage of leucovorin in treatment of autism spectrum disorders, because it looks like they actually did a study, and I am surprised that if that study was 5 years ago, we haven't heard anything about it in like the more public scientific journalism side of things. All right. Methylene tetrahydride. It's a different thing. Treating patients with relapsed and refractory germ cell tumors. Bah. Let's see. Maybe we can filter this more by conditions. No, we can't filter out cancer because we're not really interested in the usage of this in chemotherapy. That's like a completely separate subject from what we're interested in here. Let's see. Panitumumab. Now, what is panitumumab? Is that something that we need to be interested in? Side question. Panitumumab. Okay, that's a cancer therapy antibody. Let's see. In treating colorectal cancer, chemotherapy. So it looks like most of the clinical trials that have been completed and have results are on chemotherapy related things. Let's see. Colorectal cancer, pancreatic, chemotherapy, colorectal cancer. Which this say, as y'all might be noticing, going through the literature very carefully takes a very long time, because we have to go through here. If we just do something like look for a specific condition, we might miss something. If we just try to minus cancer from the results, we might miss something. So we gotta go through the results like this. Chemotherapy, cancer, chemotherapy, cancer. Lymphoma, also chemotherapy. Cancer. Lymphoma. No, it's almost entirely cancer studies that have completed with results. More cancer, more cancer. Gliomas, esophageal cancer. Which, given that it's a co-treatment with a very common chemotherapy drug, there's going to be a lot of cancer studies here. All right, all right. Cancer, cancer, cancer. Leukemia, rectal cancer. Wow. So presumably there should be some for CFD. But all of this is cancer, except for that one autism study. Now that is surprising. So we want to, we're going to go back and we're going to specifically look for clinical trials for CFD. Cerebral folate deficiency. There's only three? There's only three clinical trials on that. That's interesting. There's only one completed in 2025. Study started 3 years ago. Interesting. What is this clinical trial of? Baby Detect Project. Collecting blood spots to diagnose early developmental disorders. So it's not actually a treatment. Which makes me wonder, I gotta double check on this. I did see that there was an FDA approval of leucovorin way back, like in 2008, I believe it was. Oh right, that was in the yeah, it was approved in 2008. Let's see. Received marketing approval for leucovorin for injection. Ah, it's only apparently been approved for the chemotherapy related use. And the current approval is the first approval for cerebral folate deficiency. Now that is interesting. That it doesn't seem as if there are clinical trials on this. Taking it to the other window. Don't want weird results from Google popping up on stream. We're going to look at cerebral folate deficiency clinical trials. Maybe there are some that are just not indexed in the NIH database? Very strange. And an FDA approval with no clinical trials is not common in what I have I've looked at a lot of drug approvals, and I'm kind of surprised there's no clinical trials whatsoever, but it's getting FDA approval. All right, so we have a paper in PubMed Central on cerebral folate deficiency syndrome. And what we're mainly interested here in is clinical usage. Clinical syndrome. Very interesting. Diagnostic investigations about treatment. Okay, so the treatment here. After diagnosis of CFD syndrome caused by, this is the autoimmune autoantibodies thing that we were looking at a bit ago. Treatment should be initiated immediately using high pharmacological doses of D-alpha-linic acid. Which that's the DL here is that chemistry thing, the mirror image thing. D is the normal one. L would be the levo, the mirror image. And they're just using the raw production that has both, which is pretty typical. Yeah, it's pretty typical. Sorry about that. Shaking everything. Ugh. I worked out this morning. My legs are all needing of stretches. So these are these sources. What do we have? Play deficiency review. So this is just like a deficiency thing. Interesting. This is there is a standard treatment with leucovorin, but it seems like there might not have actually been any clinical trials of it. Huh. Care should be taken to initiate folinic acid treatment slowly during the first month using half the finally required dose, since folate increases in the brain that are too abrupt will result in elevated production of tetrahydrobiopterin, the neurotransmitters dopamine and serotonin. Consequent overstimulation of dopamine and serotonin synapses, which that's going to be an important thing moving forward. Is it is possible to overdose with this treatment. So doing this treatment when it's not needed can be a concern. Important. That is an important thing to take note of. Clinical symptoms of marked agitation and aggression occurs with 2 abrupt folinic acid dose increases. Huh. Which, fortunately, it's just behavioral symptoms that would be easy to note, and not more severe issues such as, yeah, we can use our imaginations on worse things that could happen. Now this is this is interesting. Another therapeutic option which can be combined with folinic acid treatment is introduction of a strict animal milk-free diet using vegetable milk and products. With exposure to soluble FR, which okay, so FR alpha is that FR is that protein in milk that is close enough to the folic acid receptor that the antibodies are a problem. So we have a specific that's this other paper that we have pulled up, is a milk-free diet downregulates folate receptor autoimmunity. Interesting. Oh, sorry, I lost the thing that we were looking at. Here we go. Sorry about that. So dietary measures can be introduced as soon as diagnostic investigations have been completed. Huh. That's that's interesting. So in addition to potentially treating with leucovorin, there's also a diet change that can help in cerebrofolate deficiency syndrome. Hmm. Okay, this is an interesting paragraph, it looks like. Likewise, children with infantile onset autism associated with FR alpha autoimmunity should be identified early to start folinic acid therapy and a diet as early as possible to improve final prognosis. So this paper seems to be suggesting that a subset of autism is caused by this autoimmunity. Potentially. They just say associated, which is good, careful language. But this kind of thing could be where the FDA statement on it is coming from. So the presence of FR alpha antibodies in both parents has a negative impact with poor outcome and prognosis, which would make sense. Like if the parents have the same autoantibody, it suggests that there is a genetic underpinning to like a susceptibility to producing that autoantibody, something like that. That wouldn't be as simple as just you got too much of it in your diet or something like that. And then this is a very interesting way of saying this. If treatment does not lead to any improvement, further metabolic and genetic testing should be considered, as more than 1,000 different genetic causes have been identified in autism spectrum disorders. Very important. There are a lot of things that we don't know about autism, and we know that there are a lot of other genetic causes. This, I guess, the data on the epidemiology may not exist, or I'm not familiar if it is, and that's something to look into. Is what percentage of autism diagnoses could be explained by this? Platypus, how you doing? Welcome into the the spicier part of what we're talking about here, because we're actually getting into the autism side of things here. Yeah, yeah. We're like got 2.5 hours into the science, because I wanted this to actually be a deep dive. Like this is showing how much effort there could be to going into the science behind things. Don't know what all the paper is. So what we've gone through so far, I have our master MS Paint document. The main thing that I was going into starting here is what leucovorin is. So the FDA stuff from a few days ago, at the same time as the Tylenol thing that everybody has been talking about, a large part of that uh, press conference was about leucovorin, and specifically using leucovorin to treat. I want to be careful at how I say this. That the FDA is approving leucovorin to treat cerebral folate deficiency, which can have autism-like symptoms. And specifically, the FDA approval statement, or the statement that they put out, had a lot of language about the epidemiology of autism. Now, they weren't specifically saying that they were going to approve the usage of this thing to treat autism. But the fact that so much attention was paid to that in the statement raises a lot of questions. And nobody is, like, very few people have heard of leucovorin. I hadn't. Nobody else that I've talked to about it has. And that is the thing that I went into this with the basic idea of talking about the science of this and not any like worries or like what could happen. But that is something that concerns me, is that people are going to use this as a treatment outside of even whatever the FDA approves. And yeah, having such vague statements is dangerous. Yep. That is exactly where my mind went in the first place, was, oh god, it's an ivermectin. We're gonna see Joe Rogan talk about this soon, probably. And yeah. So that, I think it is important to go through the actual science at play here. Because the science is apolitical. The science has nothing to do with the politics, so we start with the science. And that's why we have our master paint document here. Because we have our main questions here that are just the scientific questions. What's leucovorin? What's it been studied to treat? Which we've got some interesting clinical trials to go through in a minute. And what is the actual evidence for leucovorin treating the thing that it's going to be approved for based on the statement, which is cerebral folate deficiency. Oh. Yeah, alcohol does generally not help with depression. It's one of the reasons I've been trying to avoid it, just in general. But what we've gone through so far is what leucovorin is, which is that it's so essentially it is an alternative to vitamin B9, folate, that can supplement folate deficiencies. You said that today. Oh no. And we went through all of the background literature on basically going through all the data to say, yes, leucovorin, folinate, can act as a methylfolate supplement. And especially in this case, where we went through the disease mechanism of cerebral folate deficiency, and that in at least most of the cases, the disease mechanism that has been shown for it is an autoimmune response. So it's an autoantibody to the folate transporter that blocks folate from getting into across the blood-brain barrier, and that folinate can bypass that issue. So that is why, like, mechanistically, it is a treatment for a cerebral folate deficiency. Very specifically, a cerebral folate deficiency. Which that's where we've gotten to now, is we have the mechanism for leucovorin potentially for leucovorin being able to treat CFD. But interestingly enough, I can't find any clinical trials on that. It does seem like it's broadly accepted and recommended that like, this paper that we were just reading is specifically talking about cerebral folate deficiency syndrome, and that there is this kind of standard treatment for it with high doses of folinate, with leucovorin. Yeah, at least none that I can find. None that are in the clinical NIH clinical trial database, um, which is a little odd, but it happens more with things like supplement kind of stuff. Which this is essentially just you have a vitamin deficiency, and this is a vitamin supplementation. And they are referring to, at least here, the fact that it hasn't been approved. um, and at least this paper doesn't have a reference for it. But there is a like the papers that we've been going through do reference this treatment. Like this is one of the papers we were looking through earlier from 2009 that treatment has resulted in significant improvement in clinical symptoms, normalization of 5-methyl tetrahydrofolate in the cerebrospinal fluid. So here, there are at least case studies of this treatment working, and it has been kind of a recognized treatment for at least a couple of decades. With apparently a standardized like treatment regimen, at least mostly standardized. Also, why is my air conditioning just blasting now? This thing's unreliable. Having a bad case of heartburn. Ah. How much are you drinking? So yeah, it's a little not unusual, but like it would be good if there was a clinical trial, but it kind of makes sense why there's not, specifically for the cerebral folate deficiency treatment. And why that's important is this is a hey, we see there is a deficiency in this vitamin in the brain in these patients. Therefore, we're going to give this thing that we know bypasses the deficiency mechanism so that they are no longer deficient in this vitamin in the brain. Which that's also another reason why there may not be specifically clinical trials, and why the actual like letter of approval thing makes sense. Like there's no actual approval yet. The announcement was that it's upcoming, but the approval for treatment of CFD with leucovorin makes sense and isn't like super concerning as long as it's done like by reasonable doctors. Like there's problems of overdosing with it, but that's something that like there's a regimen that apparently doesn't have that issue in most cases. So for that specific condition, letter of the approval, on label usage, there doesn't seem to be any problem. That seems to be reasonable based on the literature. So we can put a like hesitant, I'm not going to make it a green because it's not fully green. I'm going to give a yellow check mark to evidence for leucovorin treatment. Because we got case studies, we got a long history of publications referring to it. I would love a clinical trial, but it makes sense why there may not be any. And now we get to the sticky part. Which, hey, platypus, you made it just in time for the sticky part. Um, which is, what has leucovorin been studied to treat? So actual clinical trials on what it's been studied to treat. And the spicy topic of CFD, autism-like symptoms, and relation between the folate deficiency and autism. So we're going to close out some of the other things that I had open. There's this other syndrome that apparently is vaguely like symptomatically related, a polyneuropathy, but that was unrelated. Um, yeah. And then there's also a very interesting thing. I don't know if you want to look back in the water or what, but the basics of it is that the potential disease mechanism for folate deficiency, cerebral folate deficiency, is that there's a protein in milk that is similar enough to folate receptor that your body produces antibodies against it. And those antibodies block folate uptake. So milk is potentially the cause here, which is interesting. Oh, which reminds me, I do want to put that in our list of questions. Is FR. Oh, wrong color. So FR alpha seems to be the thing in milk, based on the couple of papers. FR alpha is the thing in milk. In milk. Resulting in autoantibody production. Amounts, and this is the thing I'm very curious about, is amounts in human milk, bovine milk, and formula. And also, based on those studies, it doesn't sound like it's in vegetable milks or like non-animal milk things. Like, it seems like it's an animal product. Pasteurized and raw milk. I would expect so, but that's another interesting question to add on here. Is like, does pasteurization? Well, no, because most milk that is consumed is pasteurized. Like, at least bovine milk. Oh, no. These are interesting questions. That is a very interesting question that I will put on the list. Um, oh no, is ooh. We'll put amounts in raw milk as well. Um, yeesh. Yeah, I forgot that was a whole big thing now. Because there's also the raw meat thing and high meat, which is an insane concept from a couple of years ago. Okay. So FR alpha amounts in human milk, bovine milk, formula, plant milks. I don't think I doesn't sound like there is any in plant milks. High meat is a thing that is hard to find a lot of information on, but it was basically a trend where people were, shall we say, irresponsibly fermenting meat before eating it. They weren't fermenting it, they were letting it go bad and then eating it. Yes, a terrible idea. Do not eat spoiled meat, especially not deliberately spoiled meat. Okay, so now we're getting into spicy territory. Because what we have now is the a clinical trial that we came across like half an hour ago, 45 minutes ago, on folinic acid in autism. That is a completed clinical trial from 2019 uh, that has results. Haven't looked at any of the actual stuff. The enrollment's 18 subjects, so that means I believe this would be a phase. Oh, this is a phase 2 and phase 3 with that few subjects. That's surprising. Um, and it has one location. Now that is strange for a phase 2, phase 3 clinical trial. I'm also just gonna close out some things. This was overdosing essentially of leucovorin. And we're just closing out of some. This was the FDA approval of leucovorin for chemotherapy. Yeah, 18 subjects is extremely small for a phase 2 or a phase 3. Like for a phase 1 clinical trial, that makes sense, but huh. All right, so what is this study? Examination of changes in urinary metabolites, the use of folinic acid in children with autism spectrum disorder. Investigators also measure behavioral measures and academic measures monthly at school with teachers and parents report. Okay, so this is autism kids with autism spectrum disorders enrolled at a specific school. Behavioral measures taken after 12 weeks of supplementation and then 4 weeks after not being supplemented. Okay. It's a very small study. The ages eligible between 5 and 25. There's no masking in the study. And so why that's important is one of the things you do to control for placebo effects. So effects that are not from the actual treatment, but from, if you gave them sugar pills and said that it was the same treatment, you'd get the same effect. Are not controlled for. There also doesn't seem to be a control group here. Which is interesting for a phase 2 and phase 3 clinical trial. Huh. But yeah, we'll see the rest of the clinical trial. Yeah, there's no control here. Which, I mean, part of it is that it's a supplement essentially, so yeah. That could be why it's such a small study and no controls. Okay, so the intervention is 12-week supplementation with folinic acid in a pill. Yeah, it's not the best study design. And so they measured aberrant behavior checklist, parent reported, and teacher reported. Oh dang! I wish Lindsay was still here because she works with special needs children and is probably familiar with these checklists. Let's see. So scoring from 0 to 3. The total score is 0 to 174, and it looks like the higher score is more severe behavioral issues. So a higher score I guess we would be looking for a lowering of this score by the treatment. So social responsiveness scale. So this is social ability in children and young adults. Scoring on the questions can range from 0 to 3. Total possible score for 0 to 195. Lower score indicates better performance. Okay. So we're looking for lower scores on these as well. Pediatric quality of life. On the pediatric quality of life, physical, emotional, social, and school functioning. And this, a higher score is better performance. So we're looking for lower score on ABC and SRS and a higher score on PEDS QL. All right. We have one investigator, which we can look into after this. It's not really necessary. All right. So where are the actual results? Study protocol and plan. Evaluations, data collection. This is just the plan. This doesn't actually have any of the results. Wait. Oh, okay, yeah, it's just the study details. Okay, results posted. Alright, so 12 of the 18 completed the study. All 12 participants were studied. Okay, there is mostly male participants, which that does track with the fact that there is a majority of males. A majority of people diagnosed with autism spectrum disorders are male. I don't know how similar this distribution is to the general population, um, but it's not incredibly surprising. Um, but something that a larger study would wash out any um, confounding results from. All right, so this is the ABC. So aberrant. Yeah, and in this case, that is understandable from a study design, a small study, because it would be harder to find female participants, um, especially given that this is just a single school. It looks like, and something that you get a large enough study to be able to look at like subgroups like that, where if the study is large enough, even a smaller subset of people diagnosed with autism spectrum disorders can be like actually looked at specifically. So like if 10% of the participants are female, but you have a couple thousand participants, you get enough female participants to actually see any sex differences. Okay. So the ABC, this is the behavior checklist. So a reduction of minus 2.4 on a scale of 0 to 174 over the 12 weeks. Where are the statistics on this? Statistical analysis. Here we go. P-value not significant. So the p-value is it's the boiled down the probability that the results or any differences seen are due to random chance rather than a specific specific effect. Um, the lower the p-value, the lower percent chance statistically that this is due to random variations in data. And typically in science, it's you look for a 0.05, so 5% chance that this is just noise in the data is giving you an effect. And like ideally you want it to be as low as possible, but 0.05 is just like kind of the agreed upon, like 5% is low enough that we can like kind of accept this as a significant result. A p-value of 0.56 means there's a 56% chance statistically that this is just complete noise. um the teacher reported is an increase in aberrant behavior checklist. Also not significant. Yo, Spankin! Welcome to a clinical trial that's concerning. Or rather, a clinical trial that says nothing. Still working. It's been a long day. We've been deep diving into a B vitamin supplement for 3 hours now, so I kind of feel you. I know this is not really my job. My job, I don't have one of them things. B9, but um, this is specifically leucovorin, folinic acid, which there's an announcement by the FDA a couple of days ago. It got lumped in with the Tylenol thing, which not touching on the Tylenol thing at all. Not even touching it. Um, but the FDA announced that they're going to approve leucovorin for treatment of cerebrofolate deficiency. So B9, vitamin B9 deficiency in the brain. We went through all of the evidence and literature that basically that treatment, letter of the announcement, treatment, seems all right. Uh oh. Oh, Spankin. Oh no. Um I don't want to go too much into it because that subject is really fucking spicy. Like we're already on a bit of a spicy topic today looking at like treatment of autism. In general, the Tylenol thing was basically, yeah, it's everywhere, and maybe we'll go into a deep dive on that another day. Um maybe over the weekend, maybe even tomorrow. I don't know. I'll see. That the FDA announced a so the basics of it is that the FDA and the president said there is a core or a causal link between Tylenol and autism. Like Tylenol usage in pregnant women and children having autism, and advised pregnant women not to take Tylenol as an official FDA recommendation. I'm not getting into any of the like. I don't know. There's a whole lot to talk about, and it's very politically charged and very like people are yelling a lot about it for good reason. There's a lot of yelling to be done with that, and I don't. I'm trying to keep to like science here, and this is much easier to look at the specific science. It only has severe liver problems. Yeah, and it's a thing where there's been a lot of talk about it, but now there's official FDA endorsement of the topic. Um, and I don't want to dive further into it without like going on a deep dive of the literature. But there are articles out there. There's tons of people talking about the FDA's endorsement of not endorsement. The FDA guideline for pregnant women to be recommended not to take Tylenol, essentially. Hey, acetaminophen is hard to pronounce, all right? I've been having trouble pronouncing so many of the words that we've been looking at today. But in that same press release or press conference, the FDA announced that they're going to be approving folinic acid, leucovorin, for treatment of cerebral folate deficiency, which is a very specific thing. And so I wanted to get into the fact that, or not the fact, so whether that part of the FDA's approval, like what is the scientific basis there, and just focus on the science. And now we're on to the spicy side of the science, which is the focus of the FDA approval announcement on autism and whether there is any sort of link between cerebral folate deficiency and autism. That's one of our questions, is whether there, because cerebral folate deficiency has symptoms that are shared symptoms in autism spectrum disorders. They both have symptoms that overlap. But there's also overlap in symptoms between things like clinical depression and ADHD, clinical depression, ADHD, and autism. There's a lot of shared symptoms between a lot of things, a lot of syndromes that don't necessarily make them have a mechanistic link. And the fact that the FDA approval was so heavily focused on autism makes the science murky. And so I wanted to go into the actual science. And I also wanted to give like kind of a crash course on like how to do a literature review for people who aren't experienced in that. And so that's been like kind of the outline of this, is like, how do you learn about a thing scientifically when there's all this fucked up chaos around it? Oh, uh, I haven't heard back from anybody, but I did get a referral from a friend for a job application yesterday. I haven't heard anything back from. Basically, I haven't heard back on anything from anybody. So nothing has happened. But maybe encouraging stuff. Um, and so what we're going through now is a clinical trial, the only clinical trial that I can find on this subject so far that has any results. There are a bunch that are recruiting, which means that they're not going to have any results because they haven't even started yet. But this clinical trial is on treatment of children at this one school in San Francisco um, who have autism spectrum disorders with this leucovorin. It's a very, very small study, and 12 participants made it through the study. And so we've been going through the results of it now. And the first results, the aberrant behavior checklist, so this is behavioral symptom checklist, shows no effect over the course of this treatment. The parents reported a very minor 2.4 on a scale of 174 effect, but it was not even close to significant. The teacher reported change was a slight increase, but again, tiny and not significant. So on to the social responsiveness scale. So this is a checklist that is meant to quantify social symptoms of autism spectrum disorders. So this is the parent-reported change in social symptoms, which negative 7.8, that's on a scale of 195, potentially big. Again, though, the p-value is not even at the 0.05 like significance level. Like it's not actually significant here. Which in part, the size of the study is so small that it is very difficult to say whether these effects matter. Because with 12 not patients, 12 subjects, you're going to have a hard time seeing any significant result. Which is why you should have larger groups, larger test groups. It's also, these are compared to their this is comparing to their pre treatment numbers, which that would be why platypus there's no control group here potentially, is that because it's compared within group, you don't really need a control. Like you're not going to be able to see placebo effects potentially, but I don't know. If you did this on a large scale, if you had a larger group, the study design in that regard is not horrible. It's not ideal, but it's not horrible. But we're not seeing any significant effects. And then here we have the teacher-reported change in social responsiveness scale, which is 0.5 on a scale of 195. P-value of 0.95. This is a not even remote... This is a nothing. There's no effect here whatsoever in this group, in this small group. Which is very interesting. This is something that I've seen in... how to say this? In other kind of questionnaire-based or checklist-based tests like this, parents have less objectivity generally than an outside individual. Which is not to say that like the teachers don't care in a way that would potentially bias the results, but they're usually more able to give objective answers. And so the teacher reported is probably a little bit more reliable. And you can see that here, that there's a pretty big difference between the patient or parent reported and teacher reported values. But none of them are significant anyway. Seen huge trials for medicine get great results and have such a small failure and they still shut it down? Yep. Like, that's what the clinical trial system is for, really, is like you need to be very sure of your results and of effects and everything like that. And the clinical trial system is supposed to give you sure results. Yeah, so the control is sort of kind of them. But yeah, that is also the case with such a small study. They're all in the same school. It's not clear if they're all the same class. But yeah, that's what you need large studies for. Okay, so pediatric quality of life index. So this was just a general quality of life thing that was only parent reported. And this, a higher score is better. So you want this to go up. And it basically didn't change. There's a slight decrease, which is not what you would want to see. And again, not a significant p-value. So there was no result from this study. Okay, adverse effects. 0, 0. Okay, this is mortality. Good. No kids died. We love when kids don't die. That I think it should be a pretty universal thing. Is we like it when kids don't die from a treatment. Saw a death rate for a gene therapy of 2 in 1,000. Laid everyone off and shut down the whole thing. Wow, that's actually kind of surprising. Um, the two that died were kids. Yep. Yeah. Um, I guess if it's it in those cases, it often depends on like what the study is for. Like if it's for like IBS or something that has an impact on quality of life, but is not really it's not a life threatening condition, then a lot of times the tolerance for like mortality events is way lower. Um, but if it's like for something like Huntington's, where if you have Huntington's and are untreated, you will die from Huntington's. In those kind of cases, mortality events are more tolerated in results. Um, but here, no dead kids. Yes, we love that. No serious adverse events. Good. Oh, non-serious events. So we had one one incident of upset stomach and blood and stool, dry mouth, increased aggression, and a cold. And we did see in one of the other papers that we read today that increased aggression is actually a symptom of leucovorin overdose in cerebral folate deficiency treatment. This is one of the things they said, like, if you see increased aggression in the patient, reduce the treatment amount so that if you introduce folinic acid too much too quickly to even a patient who's deficient, they can display increased aggression, and there's some other symptoms that basically, this seems like if there was this incident of it, then maybe they were given too much. The thought process behind, wait, something like muscular dystrophy. Oh, oh, I'm surprised with two adverse events. Okay, yeah. There's a lot of This is calling back to some of the things that we were reading earlier. Okay, so basically, this is the only clinical trial with results for treatment of autism with leucovorin. And the results were not, they do not support the usage of leucovorin in treatment of autism spectrum disorders. Flat out, this clinical trial does not support the usage of this treatment for autism spectrum disorders. Maybe the background research suggests that there's like more room for study here, and it is a very small trial. It's 18 subject enrollment. 12 made it through the study. So there's I mean, it's hard to say from this. Like, there's no positive results here, but there's also no negative results necessarily. This doesn't suggest that there's no future for this research, but it does not support using folinic acid or leucovorin for the treatment of autism. Um, and this is the only clinical trial with results that has completed on this subject. And so we can say, with the information that we have currently, it is not reasonable, based on the studies, to endorse this treatment yet. I'm not saying it never will be. I'm not saying that is not a thing that could be used to treat autism. I'm saying that we do not have the evidence yet to use it as a treatment. And especially considering, I'm not a medical doctor. This is not any sort of medical advice or anything like that. This is from the science side of things, and having read through a bunch of clinical trials and things like that, is that we can't say that this is a treatment for autism with the data that we have. Sure, Spankin, what's up? Let me go back to the clinical trials. I want to look at more leucovorin in autism with all studies. I want to see all studies here. Oh. So the main reason I did get rid of the workout redemptions is that I don't have my second webcam working, and my current apartment is freaking tiny. There's not actually a good place for me to do that without moving a bunch of stuff around. There's only one place large enough for me to do push-ups, and it's not really large enough. I have to move stuff out of the way. So, oh yes, I can. I am very excited to be moving out of this tiny apartment and potentially into a larger one. It would be harder not to move to a larger one because they don't really exist over there. But I'm planning to move in about a month, and we'll see. We'll see if I put that back on there, because I do need to get more exercise. I do need to. I've been doing. I have a rowing machine, that is because of how tiny my apartment is. It's behind my couch, and I have to move the couch out of the way every time I want to use it, which is the best. Excuse me, the best solution I've found for it. All right. Back to the clinical trial dive. So I did a search for leucovorin and autism, and because it's a good database, any other names for leucovorin, so like folinic acid, will come up here. And so these are all trials, not just completed with results. So there have been clinical trials that completed, but they don't have results available. Oh, wait, this is one that didn't come up before. Okay, maybe we do have a larger study. Folinic acid intervention for autism spectrum disorders. And this one does have results. 99 enrollment. Okay, this is a phase 2 trial. Researchers at Arkansas Children's Hospital conducting a study looking at the effects of folinic acid on language in autism spectrum disorder and language impairment. Phase 1 confirms the child has language impairment. Child be eligible for phase 2. Phase 2 consists of receiving 12 weeks of folinic acid Oh, they did do a placebo in this one. Complete phase 2 will be eligible for an open label trial of folinic acid. So this is just the phase 2 one. Yeah, 99's better, and they have a placebo control group. Let's see. Just detailed description, go through the background research. Okay, so eligibility. So ages 3 to 14, autism spectrum disorder. They have language impairment, ability to maintain complementary, traditional, and or behavioral innovations, and to attempt to keep them constant during the study. And okay, so basically just they didn't change any other things during the study. They excluded children taking antipsychotic medication, supplements that exceed tolerable upper intake levels. Okay. Okay, so they excluded any that have kind of the severe end of the behavior checklist. So self injury, aggression, physical violence. Okay. They excluded uh, GERD, liver disease, kidney disease, drugs known to affect folate metabolism. Good, good. Any major genetic defect known to be associated with the disease. I guess that makes sense. They're excluding specifically patient or subjects who would be known to have something going on with folate metabolism. Major single gene abnormalities. Okay, so they're focusing on autism spectrum disorder that's not a like simple genetic cause like Fragile X. Which is interesting. They seem to be focusing here on uh, subjects with autism spectrum disorder that are kind of the I don't know the more mysterious cases, the like not explained by um, known mechanisms. Wow, quadruple blind. The participant. So this is a very well designed study, at least compared to the last one. The last one had no blinding whatsoever. This one is quadruple blinded. The standard is double blind, where the participant doesn't know whether they have placebo or treatment, and the data analyst, whoever's doing the data analysis, if it's the investigator or whoever, doesn't know which data is being analyzed. They don't know whether it's placebo or treatment. Here they have a quadruple blind where the care provider, the investigator, the participant, and the data analyst doesn't know the treatment. So they don't know. They have nobody know, like nobody has the information while they're doing the study. It's just recorded in a way that makes it impossible for the given person to know which is which. Wow. Yeah, this is a big difference to the last one. So this is just the structure of the trial, 12-week treatment. Um, and they tested before and after the treatment, the 12 weeks. No, a lack of sparkle water is devastating. It makes me want to pop open a Diet Dr. Pepper, but no, I'll hold off. I've had way too much caffeine, or exactly the right amount, and don't need more. Except for my last sip of coffee. It was I had to empty the cup. Okay, so the actual measures is language improvement. Um, the receptive and expressive CELF language index and preschool language scale be the primary outcome. Um, I am not familiar with those, but there should be more detail on them in the results section. Improved stereotype behavior and improved social skills. Okay, so uh, stereotype behavior is of course one of the I guess more like publicly or popularly known symptoms of autism spectrum disorders, which is repetitive movements mostly, and then social skills be secondary outcomes. Okay, okay. All right. Let's see here. He's got ADHD meds again for the first time in years. Excited to see how you're in a row. Oh yeah. And with your regular morning cup of coffee. Oh man, I I have not experienced ADHD medication, but some of the SSRIs, or not SSRIs, but depression treatments I've been on have had very immediate and noticeable effects. So, good luck. That could be fun. Or it could just be really, really good. Alright, so this is the results. Posted results section. Um. Wait. Oh, no. Wait. That's why this didn't come up the first time. It was terminated with results. It was terminated for non-compliance. Shit. Oh. The study sponsor was unable to completely monitor the study or resolve outstanding queries. Study data cannot be fully validated by the sponsor. The study was placed on full clinical hold by the FDA and terminated by the sponsor as a result of investigator noncompliance. Damn. So they didn't actually finish the study because the investigators didn't comply with some element of the FDA's, or not FDA, and I don't know, it was the FDA. Wow, that is very, very frustrating that they designed the study, they recruited for the study, but they they did something during the course of the study that was not in compliance with the FDA rules on conducting the trial, and so it was terminated. And so we don't actually have results from that. Um, just interesting. They have multiple other studies on treating oxidative stress, and it looks like yeah, it's the same hospital or the same institution. What was the actual treatment here, and why did they not have published results? Let's see here. I mean, one of these treatments was actually. Wait. Okay, folate, B complex. But not specifically. Okay, here we go. Folate is with folinic acid. I never really drink like sparkling water on its own. I for a while was drinking Lacroix, but I'm not a big fan of just sparkly water for the sake of sparkly water. I need to be that artificial sweetener. Hmm. So why is there no posted results for this? So we're gonna look for oxidative stress, autism, folinate. Let's see. Well, we do have a. I guess this would be the safety section. Some electrolyte powder with sparkly water. Cause a massive geyser. Yup, that'll happen. It's like the Mentos and Coke thing. It just goes boom. Hmm. Well, in here now we can get back to the actual like, so we can bounce from these study results because they're proving to be unreliable. Close out all that other stuff. And now we're going into the next phase of the literature review. Is we're going to look through the association studies. So, like, basically, the papers that are not fully reported as clinical trials, and whatever other studies there might be on treatment of autism spectrum disorders with folinic acid, with leucovorin. Let's see. We have a study here. Where is this at? Singapore. Okay. Within subjects, open label study, and so that could be why it's not listed on the clinical trial database, is because that's mostly American clinical trials. It does sometimes have ones from other countries, but it's uh, mostly American clinical trials, like associated with the FDA and IIH. Um, so we can look through here to see about um, results from other countries. So let me see if I can. The International Journal of Developmental Neuroscience. I don't have access to that. Let's see, the folate cycle has been implicated in the pathophysiology of autism due to its role in glutathione oxidative stress pathway. Previous research in folinic acid supplementation in autistic children has suggested potential benefits. Oh, I wish abstract had references, but I'll have to, you know, find them myself. Let's see. Okay, ratings of the effectiveness of nutraceuticals for autism spectrum disorders. So we have oxidative stress, folate receptor autoimmunity, and CSF findings in severe infantile autism. So the results: the autism group showed a significant increase in oxidative DNA damage in lymphocytes, plasma, ceruloplasmin, and copper levels. High copper levels. Interesting. Thiol protein, superoxide dismutase activity. Vitamin C levels were significantly diminished. Vitamin A and D levels were low. Now, this is where there's potentially interesting information. Is serum FR autoantibodies, which from what we were looking at earlier, those are the autoantibodies that were only present in the cerebral folic acid or folate deficiency patients. There was a study where it was that we looked at earlier. It was CFD patients and controls. The CFD patients had this autoantibody. The controls had zero. So it's very interesting here that serum and autoantibodies to FR presented in 68% of all autistic children. The 41% in parents, though, that is very strange because the other study showed that the parents of those CFD patients didn't have the antibody most of the time. I was very curious. We got to look at this paper. See if I have access to this. Hmm. Which is strange because you would, I mean, if that is the case, then you would expect them to be diagnosable with CFD and therefore treatable with folinate rather than just slipping through. It could be that if in less severe cases of cerebral folate deficiency, it is not diagnosed. I don't know the diagnosis process of it, but maybe it's the cases that are categorized as CFD are categorized that way because of the symptoms, and then they're tested for CFT deficiency. Yeah, and just that. I think honestly, most people are intrigued by this kind of like looking at science. Like we're learning together what the hell is going on, um, which is very interesting. This may be onto something. Like it may actually be that a lot of cases of autism spectrum disorder are his like mild cases of cerebral folate deficiency, possibly. Um, so this is an avenue of potential future research, and people want to learn. People want to know. No focus doing it by yourself, but love doing it in a group. And part of this is I was kind of bonked into having to be able to do this kind of thing by grad school. This is basically what grad school is. It's like having to do this kind of thing. Okay. That I love when PubMed Central has full text of stuff. It's so helpful. All right. So zoom in until you guys can actually see what's going on here. There we go. And we were looking at this paper because this paper actually looked at the folate receptor autoantibodies, which we know are, at least in the other study, only present in cerebral folate deficiency patients. And they were present in this group. So we're looking for. Okay, this is just the mechanism. Oh wow. Huh. They have an elaborate mechanism there for autism spectrum disorders. Okay. But what we're specifically looking for are the results. We want to see their actual data here. So they do have 38 patients with autism. They have 24 controls. These are all the various results. Okay, this is essentially showing they have significant p-values for oxidized DNA, for superoxide dismutase, which is an enzyme that basically it reduces oxidation in the body. So it's going to be upregulated if there is a lot of oxidative stress, which it is upregulated. Let's see. It's barely below. Copper to zinc ratio. That's really strange that they have increased copper. Thiol proteins also associated with oxidative stress. Yeah. Increased copper. Very strange. All right, so fluctuations of titers for FR antibodies of the blocking type over 5 weeks in patients with autism. So this is folate receptor blocked by the serum. So what they would be doing here is taking the serum from the patients, using it to block folate receptor activity, and using that as a readout of the autoantibodies. Yeah, that is very interesting because there are also copper processing disorders. I think it starts with a W, where essentially you have an overload of copper in your body because you can't process it, and you get like a ring of copper around the iris. Is one of the like big notable symptoms that also have a lot of neurological symptoms as well. But that is specifically a copper processing um, mutation. Oh, I'm gonna have to look that up. Yeah, that was. I think that was how I found out about that condition initially. Was I came across a picture of that kind of iris with the copper ring around it at some point, and went down a rabbit hole. Okay, so what we have here is we have two different curves. We have this is just two patients where they had a bunch of variation. It's a little bit. I'm a little bit suspicious here of this result in particular because they co-varied like this. These are very different results from two different patients, but they both reduce by almost the exact same amount from week 1 to week 0 to week 1. Um, which that could be some sort of environmental variation that's affecting a broad area. But the more likely reason for this would be that their test here, their assay, is incredibly unreliable. This kind of variation is what you would see from a very poorly optimized assay, or an assay being run by somebody who doesn't quite know what they're doing, not necessarily an actual result. And the fact that this is only two patients too, they're not doing any. These results are pretty much useless. Hmm. And it does make me a bit suspicious of the rest of the results that seem to be also based on this assay. The folate folate receptor antibody. Yeah. Hmm. Which. Oh, okay. Okay, we'll look at the other results. So let's see. Distribution of blocking binding FR alpha antibodies in 29 patients or children and their parents. What is the P and the M here for here? So P minus M minus. They don't have P or M. Blocking and binding. Not sure. I'm starting to become a little concerned about this paper. Is the fact that they don't have they're using notation here that they didn't introduce nearby in the paper is not great setup and would usually be criticized by reviewers, but we'll see if it's just somewhere that I'm missing. P minus M minus? No. P minus. Which is also partly because I'm not actually reading through the paper. Let's see, where's the figure call for table 2? Table 2, table 1, table 2, okay. Only one autistic child, FR alpha antibodies of the binding type could be detected in the absence of FR alpha antibodies of the blocking type. Okay, so the P and the M are blocking and binding autoantibodies? It's interesting that there are two different categories. But that's not particularly relevant. It's just a breakdown of the different types of autoantibodies, which would both have the same result, effectively, of reducing folate transport into the cells. This is not a very strong paper. It's unfortunate. Man, It's from, I mean, decent universities and institutes. I'm surprised here. What journal is this even in? Autism Research and Treatment. Uh, that is very disappointing. This is not a good paper. And this is why a lot of the reporting on this subject in the past few days has been talking about on on the extreme opposition side to it, which I'm trying to avoid being a starting from a point of being opposed or supporting. On the extreme opposition side, there's a lot of people saying, "Oh, the evidence is very weak, very flimsy for this," and this is why people are saying that. And I'm not going to say that yet. There's a lot more to go through. But I have not found any strong support or anything opposed. But it would be difficult to like. What exactly would you do to say no, aside from just having a bunch of failed studies? Now, what was going on with this study? Is this one just the results were unreliable? Let's see about this. Let's see, Semantic Scholar. See if I have access through Wiley. People don't like negative findings. They're also very difficult to contextualize. Like, is it a negative finding because the study was poorly designed? Was it a negative study because they didn't get results? And like, sorry, not didn't get results, but got results that were not supporting the positive findings. Essentially, if you don't have positive results, it just becomes immediately murky. Yeah, it doesn't look like I can access this paper. So we can't really look into this one, unfortunately. I don't have access to this journal. So what they say, at least in the abstract, there's a pilot study with 10 subjects consumed folinic acid supplements. There's a reduction in pervasive developmental disorder behavior inventory with treatment. So 49.2 to 44.6. And this is another one where, this is another not statistically significant result. There was not a reduction. There was a difference that was not statistically significant because it could be, yeah. That is okay. This is why there needs to be a larger clinical trial of this, because so far everything that we have seen has been inconclusive. Depending on As we saw in that other clinical trial, depending on who did the checklist, the parents or the teachers, there were different results. We don't know in this case, because I can't access the paper, who did the actual evaluation. We don't have more information. And what we really need here is a large clinical trial, like the one, a larger clinical trial like the one that was in Arkansas, except that was terminated because they were non-compliant. Oh, this is very unfortunate and a bit frustrating. All right, we'll see about this one. Targeted biomedical treatment for autism spectrum disorders. Let's see. Literature review. That's just a literature review. Okay. Okay, so this is a reanalysis of clinical trials. So, let's see. Several treatments can therapeutically target methylation glutathione pathways and folate pathways. Been studied in open label trials, double-blind placebo-controlled trial. I wonder if this is referring to the one that was terminated. All of these treatments have the potential to positively affect folate, methylation, glutathione pathways. Well, this one we can actually access because it's Frontiers. Which I love that Frontiers is an open access journal. And in my experience with them, they have been very good at the peer review side of things. They're very, they have been very thorough in what I've seen. Okay, and so where are the actual studies that they reviewed? Let's see. The treatments and placebo. Did they just summarize the different trials into one? So often, the last paragraph or two of the introduction of a scientific paper, it's important to know, will be a summary of the paper. So, okay, here we go. Some of the first cases of cerebral folate deficiency were identified to have features of ASD. All right, so in all three of these aforementioned clinical treatment studies performed by the authors, biomarkers of redox and methylation metabolism were measured. In the first two studies, changes in redox and methylation metabolism were reported, but because the studies were open label, the changes in these biomarkers were not compared to a placebo group. Additionally, in the latter study, the changes in redox and methylation metabolism was not analyzed in the published paper. Since the latter study had a placebo group, which had redox and methylation biomarkers measured at the beginning and end of the intervention, we used the placebo group as a control group for all three studies. Note, this is very bad behavior. You cannot do this. Shame on you, Frontiers, for letting this through peer review. That So what they're saying is that two studies were done measuring only a treatment group. A separate study by completely different people. Let's check. Presumably a different place. Oh, that's even worse. We'll get to that in a second. But yeah, in a completely different place, did a study in which they had a proper placebo group, and they're using the placebo group from that one study in a different place as a control for the unrelated study. The point of a placebo control is that All other conditions in the study are the same. Therefore, you know that the only variation between the placebo group and the treatment group is the placebo or the treatment. Therefore, you can use the placebo group to control for the treatment group. You cannot use a placebo group from an unrelated trial for a different trial. That defeats the entire point of a placebo. And what I noticed when I scrolled back up is that this is the Arkansas Children's Research Institute. These are the people who did the clinical trial that was terminated by the FDA. And then a group in Phoenix. These people did a clinical trial that was in some way bad enough or non-compliant enough to be terminated by the FDA, and they were not able to complete the clinical trial. But they are here using some of those results as a placebo for unrelated trials. This, I actually might have to contact Frontiers about. This paper should be retracted. Like, flat out, this is scientific misconduct. You cannot do that. And the trial was not completed. And they're using it as control for other trials. Who knows about the other trials? This isn't Frontiers. What the fuck are they doing? That's... Yeah. I don't know how this got published. Especially in something like Frontiers. I gotta look into that more. I'll do that off stream because I don't want to see that. But okay, so another study that is very bad. Please tell me at least one of these studies is in some way reliable. That's insane. This is why people have so little trust in science, is because people do this kind of shit. Oh my god. That is this is incredibly upsetting. In part because I'm a scientist and like our entire job as scientists is to not do stuff like that so that people trust us when we say some scientific fact. We have to be reliable. They don't know us. And now we know that there are sketchy things going on here. And yet this is published alongside all the things that are supposed to be trusted. I don't blame people for being distrustful of science. I wish it wasn't the case, and I'm here to try to do reliable things with science. I don't blame anybody for being suspicious when this kind of shit happens. Ooh. Oh, I gotta, okay. We're going back into science mode. We're going through the literature to see what evidence is out there. Not getting upset by blatant misconduct. Whew. Oh boy. Okay. I gotta see. So, Arkansas people is Deli Fry. James Fry is at both institutes? Weird. Just to... Okay, so this is also that Fry guy. Okay, this is a different group, it looks like. Methylcobalamin and folinic acid on glutathione redox status in children with autism. Okay, this is also a different group. Oh boy. Okay, and this we have seen before that there may be increased oxidative stress in children with autism spectrum disorder. but that's not directly relevant. All right. Um, this is a review. Yeah, this is a review, and it's referring back to that same information from before. Okay, this is an actual trial. Let me see if I have access. Go ahead. Okay, yes, this does look like it's open access. By the way, the reason I'm doing this on a different monitor is when I like to have the PDFs, and whenever I save things, it doxes my files, like file labeling. Uh, and I don't want to just like show all of my files. All right. So this is potentially an actual study, and this was the American Journal of Clinical Nutrition. Don't know that journal, so we might have to look into it. Um, his authors are at the. These are the people from the study that was terminated. So I guess this might be their results from that. No, this is before that study. This is 2009. The study was 2015. This is why we need more research funding so that actual good scientists can do these studies to either corroborate or reject findings. Because we need more people doing this. Instead of one group has apparently done all of the actual research into this. And they were shut down by the FDA when they tried to do a study. Okay, so this study was to determine whether or not treatment with the metabolic precursors methylcobalamin, folinic acid, improved glutathione redox and metabolites in autistic children. So they're treated with either methylcobalamin. Methylcobalamin is the active version of B12, I believe, which is also in my supplement. And folinic acid, which is leucovorin. So they measured metabolites in the pathway. Results indicated the pretreatment metabolite concentrations in autistic children were significantly different from values in the control children, which that is potentially interesting information. And the 3-month intervention resulted in significant increases in cysteinoglycine, and glutathione concentrations. Oxidized disulfide form of glutathione was decreased. So the actual treatment has kind of the expected results. The metabolic findings of treatment with a supplement acted as treating with the supplement in patients who were deficient. The interesting thing here is the finding that the metabolite concentrations in autistic children were different. That is potentially very interesting. Okay, so here we have mean metabolite concentrations in age-matched control children. So we have control children, we have pre-treatment, we have post-treatment. Where's the comparison with the... Wait. What? Wait. Oh. I... I wasn't reading the table properly. Okay, so this is pre-treatment in the children with autism. Okay. So methionine, homocysteine, cysteine, cysteinoglycine. So these are all metabolites of the folate dependent metabolism pathways. Not all of them isn't the thymine production, that all the other stuff that we looked at way like 3 hours ago at this point. um, so yeah, no significant difference in methionine. This is methionine related. So that was a significant difference in cysteine related pathway. And in, what are these? Glutathiones. Which is interesting. There is a difference in this group in cysteine and glutathione metabolites. Okay. Curious about their, let's see, their methods. Don't really have like recruitment information here. Like, who were these subjects? Qualified metabolically for the study. um. Oh, here we go. Participants. 40 children who had an autistic disorder completed an open label trial to test whether or not supplementation metabolic cofactors 3 months would improve plasma concentrations. So they used the DSM-4, which this was 2009. So I believe the DSM-4 was still the current edition. And so this was diagnosed by the DSM-4 criteria. It's a little bit outdated, but like still in theory viable. Okay. So this doesn't it doesn't really tell us much because there was no actual relation to the autism spectrum disorder other than potentially there's issues with oxidative stress pathways in children with autism spectrum disorders, which is interesting but not too related to what we're actually looking into here. Huh. Oh, because I did specifically. This was when I was looking into the oxidative stress side of things. Oh, most of these results are going to be talking about the current thing up here. Um, this is a case study. This is looking into the folate metabolism genes potentially in autism spectrum disorder. Let's see. Oh, this is actually a randomized controlled trial. We like that. Looks like it might have full text in PubMed, which if y'all ever use PubMed to look for articles, this is something that should make you very happy. This full text link, this free full text in the PMC means that you don't have to have any sort of institutional access or like a journal subscription or anything like that to get it. So this should be free and available. And yeah, it is. Beautiful. All right. So this is a couple of universities in China. I don't know the nutrients journal, but this is like the third time we've seen a paper there. All right, so what exactly did they do? Let's see. 12-week randomized clinical trial with 80 children with autism spectrum disorder, randomly assigned to intervention or control. Intervention group was administered folinic acid. Efficacy was measured with the psychoeducational profile. Okay, I've seen the PEP3. by okay, the evaluators were blind to the group assignments. Very good, very good. Let's see, methylene tetrahydrofolate reductase. So this is methylfolate reductase, which this is the enzyme that I've got a mutation in. Methionine synthase and methionine synthase reductase were genotyped. Gold standard methods. That keeps coming up. I'm wondering if the gold standard methods is an AI telltale, because I've seen that in a few of these papers now. That's not a common thing to say. But these are all recent papers that have said it. All right, so results. 49. Okay, they had a pretty good number that completed it. Oh, wait, I just realized this is probably way too small for y'all to see. Sorry. Is this big enough? Yes. Okay, y'all should be able to see this now. All right, so the results. Some completed. Both groups showed improvements from baseline to 12 weeks. That's very interesting. Intervention group demonstrated significantly greater improvements in social reciprocity compared to the control group. Children with the methylfolate reductase mutation. I'm pretty sure this is the same one I have. I think it's the 129 or 1298C. Demonstrated greater improvements in various developmental domains than wild type, which would make sense. Methylfolate reductase mutation reduces the efficacy at producing methylated folate, and so you would have less methylfolate, and therefore methylfolate supplementation would help, which is essentially what they were doing here with the folinic acid supplementation. Folinic acid may be more effective in certain genotype combinations. Okay, we got to see that data. No adverse effects. Yes, we like that. Okay, so where's the actual data? All right, baseline demographics. All right, so these are their scores. So we have the control group, we have the intervention group. So this is our placebo. So these are the subtests of the PEP3. It looks like the cognitive, verbal, and pre-verbal, expressive language, receptive language, fine motor skills, gross motor skills. So let's see. This p-value is going to be... Okay, this is the between control and intervention group. So there's an improvement. That is very strange. The control group had a higher baseline in all categories except the gross motor skills. Huh. There is high standard deviation here. Because that in parentheses is the deviation. But it is very unusual, especially since the increase in the intervention group is from below that to a very similar value. I guess, okay, these are non-significant values anyway. There is one significant value, which is the social reciprocity. Okay. Again, though, here, the social reciprocity in the intervention group was lower in every single measure. What? What? This is another... This is another difficult to trust result. Um, this chart is the results from their study. These are the baseline values in each group before the treatments. The control group is placebo. The intervention group was treated with the either folinate or just a combination of folinate and I think methylcholine. But in any case, it was the folate related treatments. The values of the baseline at the baseline for the control group are higher than the values for the intervention group in every category. They are saying that there's an increase in these scores for both groups, which does appear to be true by the treatment. Which, note, that's the placebo treatment as well as the actual treatment. But the increases in the intervention group, they go from a value apparently very far below the control group up to what the control group started as in all cases. Or maybe a little bit above what the control group started as. So the fact that their intervention group was, on average, very different from their control group at the start, before any treatment, is very strange. The fact that their placebo group had a similar effect on nearly every measure as the intervention, very strange. And they have one effect that was different between the groups, which is social reciprocity. Now, the fact that they have, what is this? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Wait. 11, 12, 13, 14, 15, 16. They have 16 measurements here. Now, we're going to have to go to the statistics section to see if they corrected for that. But at surface level, they do not have a good test group here, which is potentially why they have no significant results, except this one. But the fact that they have 1 out of 16 that was significant is, I don't know, everything about it is strange. We're going to go to the methodology here. Oh, where are the methods? Results, statistical analysis. Descriptive statistics were used to summarize the baseline demographic and clinical characteristics of the ASD. That's not related. Categorical variables were reported as frequencies and percentages. Between group comparisons were assessed using Fish's exact. Okay, that's not related. Independent sample t-tests were used to evaluate the efficacy of high-dose folinic acid intervention. Linear mixed effects performed to examine the relationship between the polymorphisms. God damn it. They didn't do the statistics right. Yep. Okay, so now I'll explain what I was just looking through and why all of this was fucking suspicious again. This is a more common shady thing that people do in science because they don't understand what they should be doing. So, statistical analysis in science is difficult and very important. What they did here is they have a list of 16 different tests or subtests of these two groups. Each one of these 16 things they measured and looked at the statistical comparison of, and they did that individually for each test. So I think XKCD had a comic a long time ago that it showed a good example of why this is corrected for. If you have 20 different things that you're testing, 20 different jelly bean flavors in that case on to test if they have an effect on a thing. And you have a p-value of 0.05 in one of those. That means that there is a 1 in 20 chance that the results of that one thing were just the result of random chance. If you have 20 different things and you have a 1 in 20 chance that one of them will have that value, it's very likely you'll have that happen. So what you do when you have 20 different things that you're testing is you adjust the p-values. Or you adjust the target p-value, but it's easier to adjust the p-values for readability. And so what you would do is multiply the p-value by the number of tests that you run. There's like statistical papers about like the best way to adjust those. The multiplying it by the number of times that you tested it's the most correct, but also it's extremely strict. And so there's a lot of math behind like doing it different ways, but basically you correct the p-value so that you're less likely to get just a random result that looks significant, but is actually just because you did 20 tests. They did 16 tests here, so they should have multiplied by some number. And because their one result is significant, barely, this would not be significant if they did that correction. They have no significant results here if they did the statistics correctly. And based on their statistical section in the methods, where to go? We have, statistical analysis. They say independent sample t-tests were used to evaluate the efficacy in the study. And let's double check. Yeah. What they did there was not the correct kind of statistics and would leave them open to just having a random result look significant without being significant. And so that paper does not have a statistically significant result in it. So, after getting quite fed up with the kind of muddy clinical trial data there, the next stream we went into a little bit more research just on some of the folate binding protein background research. So here's that part. There are folate binding proteins in dairy products that are associated with the cerebral folate deficiency. And then I wanted to also look at the whether that had any relation to for one thing, whether there was any association with folate binding protein antibodies that we saw last time were associated with the cerebral folate deficiency. So were those antibodies present in adults? And whether there was any association between those autoantibodies and autism. So there's a little bit more research that I came across than we saw last time. And there's still no clinical trial stuff. There's still no clinical trial things that I found. But there's a little bit of interesting preliminary research that we can go into. Oh, sorry. It's actually where most of the data on transfem healthcare is from, postmenopausal subjects. Oh, which makes a lot of sense. Like, that's where a lot of the research would have been prior to the public acknowledgement of the trans feminine community. Because that has been a building thing over a long period of time. It's not like trans femme individuals are anything new. It's just a thing that has been more publicly noted and a little bit more publicly accepted. It's been a very difficult thing to get people to accept. Okay, but so last time, the kind of key things that we need from the last time that we were looking at folate and folate binding protein was that there are folate, which is the vitamin B9, folate binding proteins in dairy products. And in cerebral folate deficiency, the actual condition that there is this approved treatment for, the children were producing an antibody against this folate binding protein that was reacting with their own folate receptors in the brain and making it hard for folate to get into the brain. So that was the kind of the key thing, was that folate binding proteins in milk were causing a essentially immune response in these children that prevented folate from getting into the brain, and that this leucovorin treatment was able to bypass that and rescue that vitamin deficiency. Nazis burning research on trans people didn't help. Yeah, that definitely didn't help. Burning research, not usually a good thing. You gotta keep the research. We can discuss whether or not the research is well done. We don't destroy it. Yeah. And so one of the very, very big things that I found in this research was, one, something to just show what the folate binding protein stuff looks like in dairy products. So this is a paper from I believe it was a Belgian group, University of Lund, Swedish group. Yeah, that's right. This is the Swedish paper. So it's a university in Sweden, and they looked at specifically the amounts of folate, so vitamin B9, and folate binding protein in dairy products. And so I'm not going to go like too deep into this paper because it's mostly talking about the like their methodology, which is it was interesting to read through from the science side of things, but probably it's not super useful. Okay. I don't like that Adobe does this. Y'all can't see it up at the top there, but this appears to be a long document. Save time by reading a summary. Fuck you, Adobe. Fuck that shit. We're adults. We can read things that are long. We don't need some AI summary of too many words. Stop suggesting that. And I can't even close it. It's not letting me close this. Fuck you, Adobe. Alright, have a good look, Chloe. Alright, so this paper, they're just looking at the amount of this folate binding protein, which is the thing that would cause the autoantibody production, and the amount of this is 5-methyl tetrahydrofolate. That's the nice little supplement that I take. Oh, let me see. There we go. Yeah, the supplement. It's the processed version of folate in the body, which it's cool that I didn't realize that the folate in milk is actually the processed version. That's nice. And it's a lot of information, a lot of a clutter here on the actual amount of B vitamins in the milk. This is the interesting thing for us, really, is the folate binding protein over on the side. So these absolute numbers here are, it's kind of tricky to really interpret them, but we can look at the differences between the different types of milk product or dairy product. So this could be our kind of like reference amount, is the pasteurized milk. This is just milk. What's notable here is that between high fat and low fat milk, there's no difference in the folate binding protein. There's a slight increase in the higher fat milk, but not really much, which makes sense. This is a protein. It's not related to the fat content. Then the ultra heat treated milk. So this is ultra heat treatment, really, really high temperature for a little while. Breaks down most of the folate binding protein. So if it does turn out that folate binding protein is a problem to have in dairy, one of the ways to get around that is ultra heat treatment. just burn out that protein pretty much. Not exactly, but uh, then they looked at the B vitamins in these two fermented milk products, but they didn't look at the folate binding proteins, so it's not really relevant for us. Then they looked at some skim milk powder. So this is powdered skim milk, and of course, crap ton of folate binding protein. But that's because this is in a powder, so it's going to be much more concentrated than the pasteurized milk. And it's also skim, so there's no fat content, so it's going to be more protein than the other ones. But there's also a lot of folate binding protein in whey. So this is whey protein, which is whey protein powder, often used in protein supplements. Maybe not great, possibly. If it turns out that folate binding protein is not a good thing to be getting into your body, maybe use like soy protein powder. Also, probably huge problems with that, but there's problems with everything. What do we do? But I think the most interesting takeaways here were that ultra heat treated milk does reduce the folate binding protein content, which something to keep in mind if it turns out that avoiding folate binding protein is a good thing to do as adults. And that was kind of the most interesting takeaway from this paper, was the amount of folate binding protein in these different dairy products. Also, that hard cheeses, so lower fat, longer fermentation time cheeses, is a lot lower than in the whey cream cheeses, the skim milk powder. So hard cheeses may be the way to go if you absolutely need some dairy. And then they also looked at the storage effect on folate, which not really relevant for us, but this paper's got some interesting data if you're really interested in B9 in dairy products. And then this part, this is a little side thing, but kind of interesting. They looked at the variation in vitamin B9 in pasteurized milk based on the time of year. And the summer milk had like double the B9 of the winter milk. It's really interesting. I guess it could have to do with like what the cows are eating at those times of year. Maybe they're not grazing as much during the winter. It kind of makes sense, Sweden. The winters are very, very cold and long. And then the summer milk has more vitamin B9. That's just interesting. I don't know. All right, so that's most of what we can get from this paper. Just a little information on the folate binding protein and on milk. Just some little cool stuff. And so now this paper, this is the much more relevant one. So this paper is looking at folate receptor autoimmunity and cerebral folate deficiency in low-functioning autism with neurological deficits. So this goes back to that potential link that was the big thing, that was kind of misrepresented in the FDA announcement. So the folate receptor autoimmunity, that is the folate binding protein antibodies that interfere with folate uptake in the brain in children, and causes cerebral folate deficiency. So this paper is talking about a potential link between that disease pathology and low functioning autism. And so what this is kind of an older paper. We don't use the um, descriptions of low functioning and high functioning autism. Um, Very outdated. But what they're referring to here is these these patients had very severe neurological issues. So, see, where was the actual description of that in the paper? Let's see. Patient population. That's right. Um, so that we can just see what their definition of low functioning autism is in this case. So the 25 patients selected for this study had early onset low functioning autism associated with one or more of the features of the infantile onset CFD syndrome. So that's one, marked unrest, irritability, and insomnia during the first year of life, deceleration of head growth between 4 and 18 months, psychomotor retardation followed by developmental arrest, with or without regression. So that's just slowing of development of motor functions. Hypotonia and ataxia presenting during the first 2 years, pyramidal deficits starting in the lower limbs, dyskinesias, and epilepsy. And so, what we can gather from that is that this definition of low functioning autism in the paper is actually much more similar to the symptoms of cerebral folate deficiency, as we were looking at the other day. And so it seems like really what they're describing here is not some subcategory of autism spectrum disorders. This seems like just undiagnosed cerebral folate deficiency, which is a very well-defined regional folate deficiency in the body. So it's a vitamin deficiency, in this case caused by autoantibodies to a folate binding protein, and doesn't really have anything to do with autism spectrum disorders. And I think that's a really key thing to note, is that this has nothing to do really with autism spectrum disorders. This is a failure of description of other cases of other disorders that is being mislabeled as being associated with autism spectrum disorders. And so this kind of shows what might be going on in a lot of the current misunderstandings and misrepresentations of this research. This is cerebral folate deficiency. Because what this paper goes into is that they measured the cerebral or the folate receptor autoantibodies in these patients versus controls. And let me see, I need to bring up that paper that we looked at last time, I think. Oh, if I can find it again. Where did I put that paper? I'll do some fancy editing because I'm making this into a video for that I'll just put up on YouTube, and I'll bring back the other paper. But this is exactly the results that you saw when they were looking at specifically cerebral folate deficiency versus controls. There are there are folate receptor antibodies in the patients that have these neurological symptoms that are not present in controls. There's lower cerebral folate, here it is, before treatment in these individuals with the autoantibodies. And there's normal serum folate in these individuals. This is just cerebral folate deficiency, as defined by all of the other research that we already looked at. This has nothing to do with some subset of autism spectrum disorders, other than a failure of definition and description. And this is, so far as I was able to find through a lot of research digging, the closest there is to actual linkage between the two. There's a little bit of preliminary research that maybe some autism spectrum disorders are actually misdiagnosed low severity cerebral folate deficiencies. But broadly speaking, autism spectrum disorders don't seem to be exactly correlated with cerebral folate deficiency, and definitely not with just treating anybody with autism spectrum disorders with a folate related treatment like leucovorin. And that, I think, is the key misunderstanding in the linking of the two. And so this paper is very interesting, but it's really in regards to the cerebral folate deficiency paper that we looked at before. So they're essentially the same results. And so that was those are the main two papers that I really wanted to talk about here, in relation to the leucovorin things. So there's a little bit of other research that popped up, that could be interesting, but I wasn't able to access these articles, unfortunately. Which, hey, we need more open access for articles here. Oh, now that's an interesting little pop-up here. This is on the other subjects in the recent FDA stuff. Acetaminophen use in pregnancy. The actual author of that study has published something to talk about the data. Huh. Fun. And so there's a little bit of research that's been done on cerebral folate deficiency in adults, and that's more where the paper on folate binding protein in milk comes in. And it, at least their results. Oh, we'll go through the case report here. So this was a single clinical case of a 58-year-old woman presented to the neurology clinic at the University of Texas at Houston with progressive memory loss and myoclonus. Excuse me. The myoclonus consisted of brief jerks to the arms and legs, did not result in disability. She had a history of rheumatoid arthritis and migraine headaches. On physical examination, no neurological deficits other than mild myoclonus and impairment of short-term recall were noted. Results of cerebrospinal fluid analysis showed low levels of tetrahydrobiopterin and 5-methyl tetrahydrofolate. So this is that processed vitamin B9. And the serum folate level was normal. So this is the classical cerebral folate deficiency result, is low cerebral folate levels and normal serum folate levels. And the interesting thing here is that her serum had that antibody, that folate receptor blocking antibody that is the other defining feature of cerebral folate deficiency. And so the cool thing here is that in this case, they treated her with leucovorin. They treated her with the same treatment as cerebral folate deficiency in the infants, as we saw in the cerebral folate deficiency research. And after 6 months of treatment, her clinical symptoms, the memory loss and the myoclonus, had resolved, and her CSF vitamin B9 levels were fine. And so this is it's just a case study, and we need more research on it. But it seems like it's possible for cerebral folate deficiency to pop up in adults. And this is why I think, if you have concerns about any of this stuff, I don't think it's like a dire, desperate thing. Again, not a clinician. I am a neuroscience PhD. But if you're really worried about it, it seems possible, one, that it's treatable, which is really good, and two, that based on the cerebral folate deficiency research, you can just stop ingesting as much dairy. Just avoid dairy for a while, and if you're worried about that, it seems like things should improve based on the other results. So this is a really cool little addendum to the leucovorin research, is that these things are there's research to show that we can test for the cases in which leucovorin will be effective. This is not something that should be given to just broad patients, probably. You can test for this. You can test serum versus CSF folate levels, and you can test for autoantibodies, and you can see, will leucovorin be an effective treatment in this case? So there doesn't need to be any like off labeling. There just needs to be diagnosis and testing. All right, and now back to the little wrap up of the first part of the first stream on the leucovorin stuff. And I think really what comes out of this is that there is potential in this field. There may be some benefit for some children with autism spectrum disorder from folinate supplementation or treatment. But we cannot say that yet. We cannot say anything about it yet because we just do not have the information. And it's difficult to say where to go from that. So we have to go back to the master paint document. What has it been studied to treat? Basically nothing in a reliable way. And is there a relation between the autism-like symptoms in CFD and folate deficiency in autism? Maybe. But we do not have reliable data. We don't know. We need to study it. This could be a very important thing. We just do not know. Oh boy. And I think that's gotta be where we wrap up the story of leucovorin for today, is that it's good that it's being approved for the treatment of cerebral folate deficiency. That seems to be very reliably consistent. People have been using it for apparently like 20, 30 years for that treatment. And having it be officially approved will be a good thing for research moving forward. It should not be used off-label. We don't have the data for that. I'm not a medical doctor. I just think that we should use science in medicine. Crazy, I know. Yeah, but I think, yeah, that's what we're gonna leave off with, is that the take home of all of this is I hope y'all can use this information to learn how to do a literature deep dive on a subject. Like that was my main thing here. I wasn't trying to like convince anybody of anything, but more show how to learn about something in a like science way, like to actually dive into the literature. And we did that. We went into the literature. We saw what the literature has. We saw where the rigorous evidence ended, and where there needs to be more. Like this is the kind of thing where if I was in this field of research trying to get money, this is what I would say. Is like, hey, we need to look into this. Please give money. Please give money so we can study it. Please give some people money to study this. All right, so that was kind of the wrap up on our leucovorin deep dive. There's some interesting stuff there, but a whole lot more research needs to be done. And as you can see, there's not really any great support so far for the usage of leucovorin in autism in any way. Y'all got to see a little bit of sketchy publications, sketchy study design, and we got to look at where things could go from here. And I hope y'all understand why some of the things are as murky as they are. And hopefully this is something that gets studied more in the future. But as for now, there just isn't the evidence to tie it to autism in any way reasonably from the data. So thanks for listening, y'all. Hope you come back to learn more science with us. Can also come see us live on Twitch. Link down in the description. I'll see y'all later.